If you've been searching for a solution to replace a full set of teeth or full mouth of teeth, then maybe I have the best solution for you. If you've been thinking about getting a denture because you think you don't have any other option, stick around because I've got a ton of information on the subject. The full arch and full mouth implant solution, all on X, and why you don't want a denture. I'm going to be talking about all the procedure and answering why you would need or want this procedure over keeping bad teeth or your existing denture. I will explain what it is and what the cost is. It's not cheap, but it's worth every penny. Let's dive in. There are two groups of people that come in for this. The first find themselves in a never-ending cycle of problems with their teeth, a constant cycle of pain and root canals, and maybe you have several periodontal disease teeth, which is a specific bacteria that eat around the bone and in between the teeth that ends up loosening teeth, gives you bad smelling breath and taste, and ultimately tooth loss. You know it starts with maybe removing a single tooth, and maybe you have to get to the root canal and a crown now, and then a root canal has failed and you're losing another tooth, followed with an implant, then implants and crowns. Some of these patients want to stop that merry-go-round and just want their teeth out and put in dentures, only to find out it's a whole new set of problems. So those already in a denture who realize it did not solve their issue, many realize it just introduced a whole new set of problems. So if you are in the first group or the second group, what you know is that you don't want a denture, you want another option. Now, the best option of replacing a single arch, either upper or lower, or a full mouth, is to get teeth that are screwed into place, and they are permanent. You don't take them out. They don't sit on your bedside table. They are teeth that can restore almost 100% of your chewing efficiency and function. This is opposed to a denture, which is about 25% of the chewing ability. So you can go out worry-free because these teeth are not going to hurt, they are not going to decay, and they are not going to move around or fall out because they're screwed in place. This is what All on X is. Maybe you've heard it as All on 4 or All on 6. You would come in the morning for surgery and leave with the teeth in place, whether there are 4 or 5 or 6 implants placed in the jaw bones. The principles of the procedure are all the same. The patient comes in the morning. If they have teeth, the teeth are removed. With teeth or without, the bone is smoothed down and leveled, and then implants are placed where it is appropriate for you, the patient. If you already have dentures and you've been told you don't have enough bone for implants, come in and let's talk. The reason this procedure is so amazing, besides everything I've already said, is because it actually requires less bone than most other dental implant procedures. We are able to use bones in other parts of the face to be able to anchor the implants in that will hold in the permanent teeth. It's really pretty amazing. And because of special abutments, we can place the implants at angles into very dense bone. The principles behind the procedure and the techniques for the implant placements are basically the same. And All on X is a generic term, and depending on the number of implants that are placed, the X is replaced with that number. But what is not the same are the materials being used for the temporary and the final set of teeth. There are several materials, and they are not all created equal. That is how pricing for this procedure varies so much all over the country. If you're considering this procedure, you'll want to check this out if you go home with a 3D printed set of teeth the same day of surgery, or if you'll be getting a converted denture, which is what most offices do. Permanent teeth screwed in days or weeks later after the implants. You'll either go home same day with converted denture, using temporary parts, which is, again, what most offices do, or you'll get a brand new smile and fix teeth with a new smile, a new life the day of surgery. But very few dentists know how this works. It's a new technology. So please, if you've been thinking about having this done, do your research and make sure you know what materials you are getting. This is a big investment, and it should be very clear to you what materials you're getting, and the pricing should be very transparent. At Alon, with myself, Dr. Oka, it's all inclusive. Yes, it's a big investment, but every patient that has done it has said it's been worth every penny that they've paid. Our office offers financing, and it's worth considering. This procedure is the most gratifying procedure I have ever done in my career. I get to witness instantly the results in gratitude. It changes people's lives in a way that nothing else I've ever witnessed. So for more information, push the button below, dare to dream, and book now, and we can talk some more.